kindly request Dr. Marielle Pariseau to make her presentation. So, Dr. Marielle Pariseau has her doctorate degree from University of Montreal. She has pursued advanced education at the Pank Institute, the University of California, San Francisco, and the University of Toronto. Marielle's expertise includes occlusion, aesthetics, camera, and smoking cessation. Marielle's mission is to connect teeth to body to make healthcare whole. Without further ado, I would like to invite Dr. Marielle Pariseau to make her presentation. The floor is yours.
Thank you so much. I have a presentation. I don't know. I'm not familiar with this platform. How do I share my screen? I do have a deck of slides.
In the options below the screen, next to the smiley face in the middle, there is an arrow pointing up, and it's going to say present now.
On the top of the screen?
No, on the bottom of the screen. You should see the microphone, camera, CC, and a smiley face, and to the right is that arrow pointing up. Click it once, and you will have to allow for sharing the screen.
Okay. This is not working.
In the pop-up menu that appears on the screen, you can share the entire screen and open the PowerPoint presentation from there.
Allow to share window, allow to share screen, the window.
Share screen. If you have the PowerPoint in application and not in the browser.
So now on top, I use Safari as a browser. It says choose content to share.
Where you have the window tab, there are like 3 columns in the pop-up menu. To the right is the entire screen, and you can share the entire screen with us, and then open the presentation. Or if you'd like, I can share the presentation with you and make you annotator so that you can move the slides. We can try that instead.
Okay, let's try that because I'm getting a message. I need to update permission with Safari, so it may be faster if you have my slide deck. So
yes. Okay.
Very good.
One second. Can you interact with our presentation?
I'm sorry, I didn't hear.
I'm asking if you can interact with the presentation right now.
Nothing happens. No, I'm not able to change the slides.
One second. It's not working. I can change the slides for you. If you could use the raise hand in the lower screen, there is like a hand icon, and you can use it to let me know when I can put the next slide, if that's okay.
Okay.
We can try it now if you want.
I just raised my hand now. Do you see that?
Okay, yes.
Okay.
Now you
So
need
let's
to
go
put
back.
it down. Put down the hand. Okay, okay, it's working.
So let's go back to, yes. Okay,
Yes.
I'm ready. Sorry about this. I was ready to present on Zoom. I'm familiar with that platform. I'm not familiar with this one. Can everybody hear me okay?
Yes, we can hear you okay.
Yes. Okay, very good. So beyond tooth decay, leveraging caries as an early warning sign for preventive health strategies. How do we move forward? For me, when I talk about tooth decay, I think of a concept that is local, limited to the mouth. And when I talk about caries, I think about a systemic issue, a systemic problem, a systemic disease. And the question is, how do we move from tooth decay to caries? Because I feel that dentistry holds untapped potential as a critical entry point for broader healthcare interventions. But this potential will not be realized until we recognize that caries is a sentinel health event. And this is an important shift, and it's a big proposition. And I would like to present the argument to prove to you that caries is indeed a sentinel event. And when we shift to seeing it this way, we will have unlimited potential to intervene early to prevent non-communicable diseases. So here are my arguments. Let's begin with teeth. They are strategically located at the entrance of the digestive tract that nourishes or malnourishes the whole body. So teeth are very much like sentinels in yesteryears, positioned along towers, along a wall of a fortified city or a castle. Uniquely designed. Here I need to introduce a notion of a sentinel species, and the most well-known is the canary that miners used to take down mines starting in the 1800s and going until very recently, about 30 years ago. And there was a reason why the canaries were very good protectors for the miners, and it had to do with a very unique difference in the anatomy and physiology of the respiratory system of the canary, and all birds for that instance. But the canaries are small, and they have an added feature: they love to sing. So because of their unique physiology, respiratory physiology, they were more susceptible to the noxious gases in coal mines than the miners themselves were. Now, if we draw a parallel with teeth, teeth are also unique in our whole body. Teeth and their enamel is acellular, and that is unique to the whole body. This means that enamel, mature enamel, is unable to renew itself or to repair itself. So this makes teeth sentinels because of their position and because of their unique anatomy. So, and I want you to consider this as well. Although there is no direct correlation between caries and non-communicable diseases, statistically, the likelihood that these diseases are not connected is extremely low. And caries and non-communicable diseases share the same causes. In addition, caries almost comes first. And let's have a look at some proofs along historical shifts that show that this works. So here we go with historical shifts. We're going to talk about periods. The Paleolithic period. During that period, the diet was mainly composed of whole foods, high in fiber, and there was no refined sugar. And paleontologists have found very little evidence of tooth decay dating back to that period. Jumping forward to the Neolithic period, also known as the Agricultural Revolution, this is a time where our ancestors moved from being hunter-gatherers to becoming a society of agriculture. They settle down, they have fields, they grow grains, and they start making bread. Bread making becomes common, and bread becomes a staple food. Now let's move to another period of the medieval and medieval and colonial periods. This is a time where there's more and more global travels. The explorers are discovering new places. They're bringing back goods such as sugarcane, and sugar becomes more available, but it is very expensive. Sugar is a luxury item. And interestingly, research shows that the incidence of tooth decay in the wealthy populations was higher than the incidence of tooth decay in the poor, which is the other way around today. And so that had to do with access to sugar. What's also interesting is this is the first evidence of people starting to have weight problems, but back during the medieval and colonial periods, these were a sign of wealth. So carrying extra weight was a sign of wealth, and so was having darkened teeth by tooth decay. To the point that some poor people would actually paint their teeth black to pretend they were rich. Imagine that. And fast forward to the Industrial Revolution. This goes back only a couple of 100 years, and this is when mankind figured out how to produce industrial quantities of goods, including food. So we see the rise in processed foods, and this revolution is important in the sense that it democratized access to food, access to goods, access to flour and sugar. And research shows that this is a time that tooth decay starts affecting all levels of populations. Whether you're wealthy or poor, tooth decay becomes common with everybody, and weight problems starts to appear. And now I've named the age we live in today, and this is my own label. I put on it the age of metabolic collapse, because this is when we see an explosion in sugar exposure. Here in the United States, 73% of foods available in supermarkets are ultra-processed foods. And we all know that there is sugar in almost all ultra-processed foods, and almost all of them have excessive amounts of sugar. And we also now see an explosion in problems with being overweight and obese. In 2018 in the United States, more than 42% of the population was obese. I don't have the figures for right now today. It may be a little bit lower because of Ozempic, but the problem is still there. And more recently, in the more recent past, what we have seen in the Pacific Islands is really important. Until the middle of the 19th century, the incidence of tooth decay in the populations of the Pacific Islands was extremely low. They had very few problems with their teeth. And there is a small research dating back to the 1950s, the middle of the 20th century, that showed a a fast increase in the incidence of tooth decay in many of the islands. And then there is a report stating that from 1980 until 2008, there has been an explosion of problems with obesity. Some of the Pacific Islands have an obesity percentage of more than 70%. So this is big. Caries comes first, and then we start seeing problems with metabolic disorders appearing next. So this is another important consideration. Let me see if I can get this right now. All right. Therefore, caries is a sentinel event. And let's have a look at sentinel events that we know of. Of course, the canary that collapsed in the mine in the ancient times, that was a sentinel event. But you'll be happy to know that many miners had a special cage for the canary. It was a box that could be sealed, and it had a cylinder of oxygen on top. So when the canary collapsed in the mine, the miners would seal the box and start pumping oxygen into that box to resuscitate the canary while they exited the mine, because they knew their lives were in danger. Now, if we draw parallels between that action and what happens today in dentistry, what we do to teeth is the equivalent of the miners giving oxygen to the canary. The sealants, the fluoride, the fillings, this is like giving oxygen to the canary. But what would be the equivalent of the miners exiting the mine? This is what we need to figure out if we want to move forward from tooth decay to caries as a sentinel health event. Other sentinel events in history, more recently, is lead poisoning in the Flint children. This is more recent. It's also known as the Flint water scandal. It started happening in the spring of 2014 when the city of Flint changed its water source from Lake Huron, close to Detroit, to the Flint River waters. But the problem was that the Flint River water was much more corrosive than the river from Lake Huron. That led to the corrosion of pipes and the leaching of lead into the water, leading to toxic levels of lead in the water of the city of Flint. Now, the residents complained. They said the water doesn't look right, it doesn't smell right, it doesn't taste right, but the city officials reassured them. And so did the physicians, that everything was okay, not to worry, it was all normal, it was due to the change in the water. And thanks to the effort of one pediatrician, Dr. Mona Hana Atisha, she started measuring lead levels in the children she was caring for, and she exposed the whole thing. But what is really to remember about this, or to know about this, is that event was preventable. And it was only a sign of much deeper problems of systemic failures at multiple levels of government. Let's move to the Lion Air Flight 610 and the Ethiopian flight, I need to stay there. Thank you. The flight 302. I'm sure you remember, these are two crashes that killed a total of 346 people. The two crashes occurred within less than 6 months apart from each other. Lion Air in October of 2018 and Ethiopian Air in March of 2019. And these crashes were related to a computer program called MCAS. And MCAS stands for Maneuverability Characteristic Augmentation System. And that had been installed on the Boeing 737 MAX to compensate for aerodynamic problems that had been built into the aircraft because of the change of engines. So it's a long story, backstory that you don't need to know. But for me, the MCAS is important because in dentistry, we have an MCAS. If you change the M for maneuverability, from maneuverability to mineralization, applying fluoride varnish, adding fluoride to community waters is the equivalent of MCAS. In dentistry, in oral health, it would be the mineralization characteristic augmentation system. And this has redirected our attentions to treating caries as a local issue. But it really isn't. It's a systemic issue. So they are also striking similarities with the crash of these Boeings and what's happening in dentistry with the ongoing issues that we have with caries that had been predicted to have disappeared in children and young adults by the turn of the century, and it hasn't 24 years later. So there are similarities there that expose a much bigger problem that we need to deal with. And the last example of a sentinel event is delay in treatment. And this is a sentinel health event. And this happens when a patient goes to their doctor with a list of symptoms, and the doctor reassures them and says, no, don't worry, everything is fine. And later the symptoms become much worse, much more acute. And by the time the patient is diagnosed, it's too late for effective treatment. Instead of treatment, it becomes hospice care for stage 4 cancer. So these are all important preventable events that show a deficiency that is much bigger than the event itself. All right, so I'm ready for the next one now. So caries is a sentinel health event. Let's have a look at the definition that is provided by the National Institute of Health. A sentinel health event is a preventable disease, disability, or untimely death whose occurrence serves as a warning signal that the quality of preventive and/or therapeutic medical care may need to be improved. Caries is a sentinel health event. It is a preventable disease. And if we move to the concept that it is a sentinel health event, we can also prevent chronic non-communicable diseases. Because if we don't do that, by not addressing caries as an early warning sign for systemic issues, healthcare providers miss critical opportunities for preventive care and early intervention. And this is what we must look at. So what do we need to do to move forward? Well, we need to remember that almost all children are born with perfect teeth. Almost all children are also born with perfect health. And it is our job to keep them that way. So what do we need to do to move on with systemic change? We must remember that teeth don't function in isolation from the rest of the body. They are the first in a long list of tissues that are exposed and show the impact of the unhealthy imbalance in our modern diet. And we need to remember that dentists are like first responders to the health corrosion brought on by the ultra-processed foods. The task in dentistry is to shift our approach to treating caries as a local disease to treating it as a systemic disease. And this comes with the obligation to educate the oral healthcare providers to this shift as to the nature of this shift and why it's important to do so. And moving to systemic health, we must include data from the mouth, include data from the teeth, because healthcare without that data is incomplete and leads to delay in treatment of non-communicable diseases. It is essential that we educate medical teams about the nature of caries as a sentinel health event, and to establish bidirectional communication. And finally, systemic change will occur when all healthcare teams come together to devise effective and simple ways to integrate oral healthcare into the overall healthcare system. Integrating targeted data from the mouth into electronic health records is a must. And I had to put this here. I'm a big Formula One racing fan, and I'm fresh back from Las Vegas, where I saw the race there. I had tickets. And I need to take a little detour to talk about Formula One, because we can, if we can emulate what they do in communication, we'll be on our way to solving the issues of caries and non-communicable diseases. If we look at F1 races, back in the 1950s, when community water fluoridation was becoming policy here in the United States, a pit stop in F1 was around 1 minute. Today, if you're an F1 fan like me, you know that a pit stop is around 2 seconds. And everybody in the team is important. There's enormous amounts of communication. And I know you'll say, well, there's been advances in technology. And of course, technology has contributed in shortening the length of the pit stops in Formula One. But their system of communication is remarkably good and advanced. And they also do sentinel event reviews regularly. As a result of each race, when a little event occurs, they get together as a team, not blaming anybody, but getting to the root cause of what that event, what caused that event, and they solve it, making them better and better every time. And of course, the team that has the best communication system and the best engineers and the best of everything usually wins. It's not just the pilot that wins the race. Just like physicians on their own and without data from the mouth are not able to heal their patients. Communicating data from the mouth augments everybody's healing power. So I've gone ahead, and maybe some of you have seen this when I spoke at other conferences. I've created the first prototype that needs to happen within dental clinics. It's a Caries checklist. So checklists are ever present in aviation. They are present in medicine now. Thanks to, I forget his name now, there's a doctor who implemented checklists in hospitals. So I created a checklist for dental clinics. The first one leads to a critical pause point. It has to do with a diagnosis of caries in a patient's mouth. And we need to pause and ask ourselves these questions. Is it reversible or irreversible? Is it one tooth or multiple teeth? Is it a first occurrence or is it a recurrence? These questions are really important to ask ourselves and to provide answers for, because it gives us an indication of the amplitude of the disease. And the second set of checklists that comes with the second critical pause point has to do with before initiating treatment. We have to ask ourselves, has the food journal been completed? Has it been reviewed? Does my team know how to relate what is seen in the food journal to what's happening in the mouth and the rest of the body? Have we contacted the pediatrician or the family physician? And finally, in the third column, there is another critical pause point that comes with another checklist. It's at the completion of the local treatment, administering oxygen to the canary. We've done that. The canary is alive and well. So it's no longer about saying to Tommy, like, you're okay, you're all fixed now, we'll see you in 6 months. We need to change this to going through this checklist of who needs to be contacted. Has the pediatrician been contacted? the school nurse, she needs to know about that. And what other consultations do we need to have? And finally, at what interval are we going to see this patient? 2, 4, 6, 9, 12 months. This is no longer a cookie cutter approach where we see everybody every 6 months. Little Tommy, who just had 5 fillings, is at high risk of recurrence. We need to make sure he gets seen at the appropriate interval. And moving forward into the bigger system of healthcare, it's important to incorporate data from the mouth into the electronic health records. And this, again, is a prototype. I'm still working on it, and I'm planning on taking a course in January with artificial intelligence, because I know that with AI, I can figure out how to incorporate this important set of data into the overall electronic health records. And because I know that physicians are extremely busy, literally overburdened with information, unfortunately, that's been brought up with the massive amounts of records they receive every day. I've designed it to be simplified and include flags. So, for instance, all that will show in the EHR for a patient that has no caries detected, no periodontal problems detected, and no concerns, all the physician will see is a green flag. And that will be a cue for the physician to first congratulate the patient on his good oral health and connect oral health with the rest of the body, and praise that person for the fact that likely the rest of the body is in very good shape. And then I've introduced a red flag, and this is for the other type of patient who has a yes to caries or a yes to periodontal disease or both. And so therefore there are concerns for the systemic health of that patient. And now the physician, seeing the red flag, can open and can see how serious the caries disease is, or how serious the periodontal disease is, and check what other systemic issues that may be jeopardized by what's happening in the mouth, or by the warning that's happening in the mouth, and see to it that some tests are being done early. For example, A1C, or the glycemic index, or a lipid profile, to start checking before the signs and symptoms of systemic diseases, chronic, non-communicable systemic diseases related to diet manifest themselves. So we have a huge potential there, but this again is just a prototype. And finally, there's another flag that comes in, and this is a yellow flag. And that indicates to the physician that this particular patient has not been seen in the dental office for 12 or more months, and it can prompt different questions from the physician. Why have you not seen a dentist? Has your dentist retired? Can we help you find a dental clinic? If it's an economical problem, then perhaps that clinic, that medical clinic, can help find a clinic for that particular patient. So these are all things that still need to be developed, and they stand to save a lot of money to the whole system. So, in other words, teeth are sentinels, and decoding their message can reshape public health. And before I go to the last slide, I'd like to mention that here in the United States, the budget, the expenditure for healthcare is $4.5 trillion. That's enormous. But here's what you need to know, is 90% of that budget goes to the treatment of non-communicable diseases. So imagine if we could, from shifting our perspective from tooth decay to caries, from moving forward into seeing caries as a sentinel health event.
Dr. Pariseau, your microphone is muted.
Okay.
Now it's
I
good.
don't know.
Okay, now we
Okay,
can hear you.
Sorry.
Let's
So
continue.
where did you lose me?
It was 15 seconds ago. You just started
Okay.
talking.
It was around 90% going to a certain group.
Okay. Thank you. So yes, so 90% of $4.5 trillion goes to the treatment of non-communicable diseases. So that's a lot of money. That's $4.05 trillion. So imagine if the shift that we propose, and I think by now I've proven that Caries is indeed a sentinel health event. So if we manage to create that shift and to move forward into seeing Caries as a systemic event, a systemic disease, and by doing so, we reduce the incidence of non-communicable diseases by only 1%. In the United States, that will be a savings of $50 to $60 billion a year. So the way I see it, it would be quite reasonable to ask government agencies for a loan of $30 billion to get this process started and see what we can achieve with that. And over the years, I'm convinced that we could see a reduction of well over 1% in non-communicable diseases, and therefore reduce the burden of these diseases on populations around the world. So my next slide is the last one. Oops, it's gone. So in a nutshell, Caries is a sentinel health event. I rest my case. Thank you so much.
Thank you very much, Dr. Pariseau, for a great presentation and the importance of collaboration and also importance of artificial intelligence in diagnosis and classification, and also the importance of the result of this artificial intelligence to find ways of treatment in different fields of nutrition and so forth. And that's a very, very important point that you made. And you made it very colorfully based on history and geography. God bless you. Thank you very much.
Thank you. And if anybody has questions for me, I'll be happy to answer them.
Marielle, thank you for your presentation. Thank you so much.
Thank you. You're most welcome.